Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain Free with Dr. Marc Darrow from the Darrow Stem Cell Institute in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor, board certified in physical medicine and rehabilitation. He teaches about the use of prolotherapy, PRP, and stem cells. Today's program could open up a new life without pain for you. Now, here's Dr. Darrow with his co-host, Nita Valens.
Hi there, Dr. Darrow.
Hello, Nita Valens. How are you today on this beautiful day?
I'm great. How are you?
I'm living it up like always.
Well, that's very exciting. Do you think that we can help our listeners live it up? Because I think lots of them are in pain.
That's the plan. How do we get rid of pain that is musculoskeletal in origin? We use what is called today regenerative medicine. That means we regenerate or stimulate new tissue to grow back. So this works on your tendons, ligaments, your joints. It works literally from the top of the head to the bottom of the feet and everything in between, all of the joints. I treat shoulders and necks and backs and hips and knees, toes, ankles. I've got a question here actually that we can go to in a second after I give out the phone number.
Okay, and the website.
Yes, all the good stuff. And we're going to send you a free copy of this book that I'm showing to the camera right now. It's called Stem Cell and Platelet Therapy. Regenerate, don't operate. Regenerate meaning to grow back the tissue instead of operating and cutting tissue out. I'm not for that. I was being trained to be an orthopedic surgeon until I had a shoulder surgery in medical school, and that was it. I switched horses midstream and decided to do regenerative medicine instead because it healed me. It's healed both my shoulders, both my knees, my elbows, my right wrist, my neck, and my back. I was a wreck, you might say, from gymnastics and all kinds of sports that I did. I loved high speed, and I loved my muscles growing on my body, and that took a toll. In my 40s, I was a wreck, and I learned about this, and I got better. I'm in good shape. And the funny thing that people can't believe is, if you want to call it funny or weird, is I do these injections on myself. So I know what it's like to get the feeling of the injections. And I know what it's like for you to get the feelings of the injection. That's why I used thinner needles than most guys do. The phone number, if you want to talk to me right now, and you will get, if you call in, a free copy of Stem Cell and Platelet Therapy, Regenerate, Don't Operate. This book is all full of scientific studies on how to heal the body without surgery and why surgery fails so often. And we're still, unfortunately, in the culture of surgery, and it is shifting. There are more and more doctors who are learning how to do regenerative medicine. I've taught it at UCLA to the physical medicine rehabilitation doctors. I taught there for 20 years. I was assistant clinical professor of medicine there. And I still have doctors from all over the world who train with me. They fly in, spend several days. I just trained a buddy of mine in Hawaii to start doing this there. And actually, while I was doing that, I got my medical license in Hawaii just in case I had to come over there to do some work.
Oh, just in case.
Yeah.
Oh, yeah. It's always good to be prepared. That's the Boy Scout motto. Were you a Boy Scout?
I was a Boy Scout. How did you know that? Yes.
Because you always are being prepared. That's good.
Yeah. And when I was, it was so cute. I remember being a Cub Scout, and my dad would be, I think he was called a Scout Master.
Yes, that's what they were called.
Yeah, it was fun. So anyway, the phone number to get a hold of me right now and talk to me, ask me questions about your musculoskeletal pain. And if you're shy, just use a fake name or say it's your mother or your father or your friend. Or you can get to me on my website. Every single page has a spot to email me. And that website is www.lastemcells.com, www.lastemcells.com. And there's videos of me doing these procedures. You can watch, see if it's something you want to do. And then the phone number to get a hold of me right now in the studio, live and local, as Dr. Gene would used to say, is 86. God bless you, Dr. Gene. I should call you up, see how you're doing. He used to be my radio host before Nita was born. The phone number here is 866-870-5752. Please write it down and give us a call. If you're driving, pull over the side of the road, write it down. 866-870-5752, 866-870-5752. And if you want to get a hold of us or my staff at my office, the phone number there is 800-300-9300. That's pretty easy to remember, 800-300-9300. So before I get going, Nita, is there anything else you want to say before I take this question?
Well, I want to let people know that when they go to the website, they can email you off of every page on the site, as well as see you performing the treatments on a whole bunch of videos, all the different body parts. So it's very cool. So that site again is www.lastemcells.com. That's lastemcells.com. So if you're driving, pull over to the side of the road, jot it down, and you can check it out later. Or you can call us at 866-870-5752. You don't want to hear Nita and I just talk. You want us to talk about something that is important to you and your friends. And every time a person calls with their aches and pains or syndromes or meniscal tears or rotator cuff tears, whatever those things are that are bothering you, you can help everybody else also. So it's a service to call in. So this question says subtalar joint surgery. Ooh, let's figure out what that is. Okay, before you get into that, though, did you want to talk to Tracy in Manhattan Beach?
Oh, yeah, we got a few callers already. Yeah, Tracy, let's go to you. Your son has lower back pain, is that correct?
Tracy, are you
Doctor,
there?
I'm a patient, as you know.
Oh, Tracy, I know who you are. Yeah, you're one of my favorites. How are you today? I haven't seen you in ages.
I'm good. This is about my son. He's 39 years old.
Okay.
He skied Mammoth last weekend, and no problem there. Tuesday, he came down with pain. Wednesday, he was in the ER. He got an X-ray, an MRI. They put him on prednisone, a steroid shot, morphine, and Percocet. Thursday, he saw a surgeon, and the surgeon, I think rightfully so, thought it'd be better to wait a while and see how it comes out.
What was it that happened? What did they tell? What did they say the diagnosis was?
I've got the MRI impression here, and this is a comparison to an MRI he had in 2017.
Okay.
It's got a new right foraminal disc protrusion.
Yep.
That's the existing right L4 nerve root.
Okay.
And a slightly increased right subarticular foraminal, disc protrusion likely abuts the traversing right S1 nerve root.
Okay. Can I respond to you?
Yes.
Okay. Does he have leg pain or back pain?
Leg pain and back pain also.
Okay. So typically, I will work on the back, and those things that show up in the MRI don't necessarily cause back pain, but they could cause leg pain. It's possible that you could have back pain also from sprained ligaments that hold the back together, iliolumbar ligaments and other things that are important. There are interspinous ligaments. And personally, I don't like taking prednisone by mouth because it can kill the hips. So I don't give that to people, but I know it's sort of the tradition of medicine to do that. When did he start the prednisone, the oral?
On Wednesday afternoon.
Okay. Is he feeling better yet?
One of those 654,
Yep.
down.
Yep. Is he feeling any better?
Yeah, he is somewhat better, but
Okay.
At least it's workable. He can work from home.
Well, that's good. Well, if you want to drag him into the office, I'm glad to take a look. In 1 second, I can just touch the area, do a quick exam, and let you know if I can help him.
Okay.
I know we've had great success on your body over the years. And how old
Yeah.
are you now, Tracy?
I just turned 80.
Are you kidding me? My God. Tracy, you are the youngest 80-year-old I've ever met in my life. Tracy is
I
super
don't know about
active.
that, but I am going skiing a week after next.
There you go. I know. And we've had terrific success, I know, in your body. And if you want to drag your son over, the office number is 800-300-9300. You can call there now and get an appointment set up. And I would love
I'm
to.
I think it's worth a shot. No pun intended.
Yeah, pun intended, right. Yeah, I'd be careful not to get sucked into getting a surgery for that, because a lot of people have that and have no pain at all. So don't assume because you have that there is pain that is with that. X-rays, MRIs, CT scans are big liars. A lot of people have problems.
They do help you somewhat, I take it.
They can, but they can also hurt you, because a lot of people get surgeries based on them when it wasn't showing what the pain is being where the pain is being generated from. So they're kind of a wild card. They can be helpful or they can be a problem. And way too many surgeries are done because of them when the person didn't need any surgery, and we could have just injected with stem cells or platelets and healed the area up. You know this. I've talked to you about this over and over the years that you've come to see me.
Also, is it better for him to finish the course of prednisone before he sees you?
Yeah, you don't want to cut that off too soon, because he can go into adrenal failure.
No, it's one of those ones where you taper it.
Yeah, well, let him taper it down. Yeah, I don't want him to just stop abrupt. Let him taper it down till it's done. I don't want him to stop abruptly, because he can go into adrenal failure or other things. Yeah.
Does the prednisone affect any of your shots? Like I know that you don't like ibuprofen and what have you.
It would affect it if he's still on it, but what we're going to do with him is we're going to do an examination first, see if I can help him. If I can, he'll come in when he's finished with his tapering dose.
Okay.
But he might be done by the time you come in. And by the way, if you have trouble getting into the office quickly, because I'd like to see him soon, you have my cell number, right? You just call me up.
I do, yes.
Yeah, just call me up and I'll slip you in anytime you want.
Okay. If I can't get through the front office staff, I'll call you.
Yeah, exactly. And you know this, Tracy. Every one of my patients gets my cell number and my email address, so I stay close with my patients. And I love my patients. I love you very much, Tracy. You're an amazing person. And it's been great working with you all these years.
Thank you for the advice, and I will call the office.
All right. Thanks so much for the call, Tracy.
Thank you, Tracy.
Okay.
So this is a perfect case of someone who will probably end up getting a surgery unless I get to him first.
Yeah, exactly. I get it. Okay, you want to give the phone number?
Yeah, give me a call right now, 866-870-5752. I'll repeat it, 866-870-5752. And if you want to call the office, there are people there now. The number there is 800-300-9300. And if you want to watch these procedures, you can watch me injecting the low back as I would do on Tracy's son at some point probably. That's www.lastemcells.com, www.lastemcells.com. There's a spot to email me on every page, and there's videos on most parts of the body of me injecting. I'm not limited to the back or neck or the elbows or the wrist or the fingers. I do the whole body. Whatever you need, I can inject, and with stem cells or platelets, and stimulate the tissue regrowth and hopefully help you get rid of your orthopedic pain.
Okay, should we talk to Mo in Orange?
Yes, Mo, Dr. Marc Darrow, how are you today? Thanks for hanging on.
Hello?
Yeah, Mo, yell at me. I can't hear you.
Hello?
Yeah, there you go.
Can
What
you
kind
hear
of-
us?
There?
Yeah. I'm here. Can you hear me?
I sure can. Thank you for
Good.
taking my call.
What kind of hernia do you have?
Down in the groin area, I guess it's called I don't know how you pronounce it. An inguinal?
Yeah, you're close. Inguinal.
Inguinal. Okay. I went to see the doctor and they wanted to do an ultrasound
Yep.
and surgery,
Yep.
and so I don't know. I've been wearing a belt for work.
All right. Does the tissue stick out?
Yes, it does.
Okay. Okay, so that's not something I can help you with. Back in the 1800s, there was a doctor named Perret in France who did this work on hernia repairs because surgery was dangerous then. And he would just do injections with something very caustic and heal the area up like that. But it's not the best way. And surgery is the best way as of today. I would be careful not to get mesh put in there because there's a lot of lawsuits out there. You can look up on the internet, mesh hernia lawsuits, where they have to take the mesh out. It seems like a good idea to use the mesh to hold it together, but then people have problems, pain problems afterwards. So I'm not a surgeon. Yeah, I'm not a surgeon. I don't do those surgeries, but be careful when you get it done, how you get it done, and go to someone who you're not going to have to go back to for a revision surgery later. Okay? Now, there is something else that goes on that relates more to my practice, which is called a sports hernia. And that's different than an inguinal hernia. That's where the adductor muscle, the muscle in the middle of the thigh, goes up and attaches to the pubic bone. So a lot of people come in, they go, I've got a hernia, and I examine them and I go, well, you don't have an inguinal hernia, you have a sports hernia, and I can fix that by injecting platelets or stem cells there both and sort of regrowing that tissue, that connection of the muscle to the bone. So from what you're telling me, you have an inguinal hernia. You may also have a sports hernia at the same time.
Yeah, I was just going to say, are the symptoms the same?
Well, with the sports hernia, it feels the same, but the tissue does not distend out.
Oh, okay.
Yeah, and you should get an ultrasound to see what really is going on. So I would go ahead.
Is it arthroscopic surgery? Is that what is that the method they use?
Well, arth means joint, so no, it's not arthroscopic.
No, I think it starts with an L. Arthroscopic?
No, it would. I don't know what it is that you're referring to. There's a lot of different ways to do a surgery. But endoscopic would be more of using a camera, scopic, and then endo means going into the tissue. Arthroscopic means going into the joint. But talk to your surgeon, and then if you want, you can email me on my website at www.lastemcells.com. I'm glad to, well, actually, I'll have your phone number from you calling in, and I can get a hold of you.
Great.
if you ever want to talk more.
Okay, I appreciate your time. Thank you. I love your show.
You too, man.
by the
Thank
way.
you. I appreciate you. I appreciate your call.
Yeah, thank you.
So
God bless you guys. And
God bless you too.
Thank you,
you
Mo.
so much.
Bless you
So
too.
You guys
for the
do a
rest
great
of you,
job.
well, we're working at it.
Thanks.
I've only been doing this show 20 years, a little bit more since my babies were born. But I love doing the show. It's a lot of fun educating people. And I love that the work I do is sort of what I'll call maverick. And maverick meaning it's not necessarily the tradition of medicine. And of course, I know standard traditional medicine backwards and forwards. And I went to UCLA for my medical residency, so I'm very well trained, obviously. But I don't find that. Well, if it's something you got to do, it's something you got to do. But it's something you can talk to me about later, and you can call the office anytime to get more information at 800-300-9300, or if you want to come in for an appointment, and we can talk more there. But we can talk. Just go to the website www.lastemcells.com, and you can shoot me an email from there, and we can talk anytime.
Okay, great. Thank you very much. You guys take care and God bless you both.
You too.
All right. God
Thanks,
bless
Mo.
you too. So give us a buzz right now at the station. It's 866-870-5752. I love taking the calls and talking to people. And try to stump me with something I don't know. I'm not going to be shy about not knowing something. I don't know everything. And I learn a lot from my patients. And I actually learn a lot from people calling in, because often when they call in, I've got to get on Google and figure out what they're talking about. And then I learn something from that too. I want to continue learning every day of my life. That's what makes life fun for me. I love to learn. You know, I did 22 years of college, including law school and medical school, medical residency, fellowship after that. And I actually did a master's of tax when I was a lawyer at night, which took me 3 years at night. It was a very busy time. But I love learning. And medicine for me is the ultimate learning, because it goes on, infinitus, infinitum, whatever those words are that I'm making up.
On and on and on.
On and on and on. I will never learn it all. And I like that. I like that it's endless. I love that there's endless universes. You know, I just finished a book by Neil deGrasse Tyson on astrophysics, which is not something I've ever read about before. I never took a course on it. And I do audible.com in the car. Every time I'm in the car, I'm listening to a book. And I just looked at the list. I've read 300 plus books in the car. So anyway, I read this book on astrophysics, and it opened up my vision of what is going on here. It's endless. It's totally endless. And I love that. And I love, the spiritual intertwinement of astrophysics and spirituality. It's endless.
It is. I'm fascinated by it also.
And
I love
you
that.
being a doctor of psychology, your work is the same. It never ends. You never know it all.
Absolutely.
And you'll get
there's always a surprise.
There's always a surprise. There's some new patient you'll get next week who's going to teach you something you never even thought of before. And that's why I love the work I do.
That's true.
People say, Mark, you're 74. You've done this for a long time. Don't you think you should retire? I go, what would I do? What could be more fun than what I am doing? And people say, well, I guess it's not work. I go, it isn't work. It's better than any hobby I could ever conceive of.
And that's the distinguishing factor, that if it feels like work, then you use words like retire and all that kind of stuff.
and what a long day it was.
Yeah, if it doesn't feel like work, then there's no conversation in that realm.
No, I mean, I had jobs when I was young, and I was always watching the clock. Now, in the practice of medicine for me, the day is over in 1 minute, it seems like. It's never long enough. I just love it, and I'm very fortunate because I love talking to people, and I get emails from all around the world every day, all day long, and I get to talk to people and do emails when I wake up in between patients at night, and I give out my cell number so patients call me all the time. I love it. It's the perfect line of hobby for me. It's not work. It's just fun. I love watching people heal. A lot of times when I'm at a party and people say, what do you do for a living? I go, I watch people heal. It's exciting. It's fun. Not everybody heals. Most of the time it's because they don't listen to me. I had a guy come in yesterday who was 91 years old, but he was like a 20-year-old. He had so much vigor in him. And he said, what do you think the chances that I would heal? 10%, 20%, 30%? He was tying me down, right?
Yes.
And I said, based on what you had, which was low back pain, and I touched the body, he was typical for low back pain that I can heal. I said, based on what I see here, you have about an 80% chance of healing if you listen to my advice. And he goes, well, what do you mean if I listen? I said, too many patients cheat on me. So, meaning they don't follow my advice. And I had someone yesterday also come in. I'm trying to think what happened. It was a shoulder. So I did one stem cell injection on his shoulder 2 weeks ago. He came back and said, I didn't get any better. And I said, pickleball, right? He goes, yeah, I played 3 times. I go, you didn't listen to me.
Ah.
Anyway, give us a call right now. Let's talk to you, 866-870-5752. God bless you, everybody. We're going to a break. We're going to come back for another half hour. Thank you, Nita Valens.
Well, thank you, and we'll see you in just a minute.
You're listening to Living Pain-Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300.